It's Lauren. So I have a bone to pick with myself in a way. Um, Full disclosure, I need to apologize to all of you because this whole time I have been encouraged and told repeatedly that I need to be building out loud. And part of the purpose of my YouTube channel was to build out loud. And this is coming from a person that is not a social media person. I'm not a social media person at all. At all. I'm not a social media person at all. Um, and learning what I've learned so far, and I know it's just the tip of the iceberg, right? But like learning what I've learned so far to becoming a founder, to building with intention and trying to build the right way. It has been an incredible journey, but I promise you, it is like, and the journey is just getting started, but I promise you, it is like learning to swim and learning to sing at the same time. I don't know a single person who can swim with their mouth open, much less belt like Mariah Carey, but that's what I've been trying to do. So I've been working on my swimming. Let's just say that in the least. Let's just say that in the least. So yes, I am a founder, and I'm a founder of Trimesters. And the folks around me that are close to me have an idea of of what this is about and what is being built. And it's really exciting because it's unprecedented. Like, I don't see anything like this out there. And I think the time is now for this. I realized that need pretty recently here. And I kind of sunk my teeth into literally building courses for moms, courses for providers on how to use technology and specifically how to use this technology. But in order to do that, first, I have to level set a little bit. So I threw together a quick little gamma, and I'm going to kind of walk you through it. I want to define application first and foremost, because application is a term that's thrown around a lot. And when people say application and they're connecting application with what we're building at Trimesters, I don't think we're on the same page at all. I want to explain a little bit about what an application is first and foremost, because from there we can move into the differences between an application and what Trimesters is, and an application and what Trimesters Ester offering is as well. So application is, so core functionality, it is a program for a single, like for a specific task, specific task for a specific audience. An example is a word processor, a database, image editor. These are literally like applications. I even like to think of applications like tools, right? Like people are like, you'll see online all the time. There are people like, oh yeah, AI is just a tool. AI is just a tool. It's a tool. It's a tool. It's a tool. Well, sure, AI is a tool. Yeah, it can be, but guess what? Your AI agents are calling tools. Your AI agents are literally using tools, right? So you can have an AI agent, a single AI agent, use a word processor. You can have a single AI agent retrieve information from a database or even write information into a database. You can have an AI agent edit an image. So use an AI, an image editing tool. You can have AI that uses an image, that you can have an AI that literally, like a tool, right? or you can have an AI agent that will go over here, generate the image for you, pass the image off or refine the image, and actually store that image in a database if you want, which is another tool, right? And then you can have that linked to another tool, which is a word processor, so that you can get the alt text out of it. Like that's just an example of what I'm talking about when I'm talking about an application, which I consider applications like tools, right? I mean, applications can have agents within them, but I mean, the term application is just really fuzzy and weird. But anyway, but with an application, typically the scope is very limited, right? And it's for a very specific function. Okay. Um, and of course, again, as I said before, it can be enhanced with features and yeah, and then of course there are examples here. Okay. So this is my long way of saying or letting you know that the that Trimesters, which is my startup, is not an application. Is not an application. Right here, Trimesters is actually an AI native platform. So here it is. It is an AI native platform. So first of all, it's not a platform with AI in it. It is native. AI is native to the foundation, to the core, to the inner workings, to the identity, to the DNA of this platform, right? AI is the fundamental component, and it uses data-driven, evidence-based architectures to continuously learn and adapt. This was very I don't want to say it was strategic, but this was intentional, right? Like I'm sorry. I have a background in healthcare and quality and clinical performance, and I'm very lean. I run my household lean. I run my initiatives lean. If you have ever received my services, like my consulting services, I love to get rid of waste and I love to talk about longevity. I do not believe in solutions that are here today and gone tomorrow. Like I imagine, think about a bridge, right? You're building a bridge to a better tomorrow. You want that bridge to be able to withstand all four seasons. You want that bridge to be able to withstand the weight and the stress that will be put upon that structure. You want that bridge to be able to work so that people, cars, whatever vehicles can get across it, right? Like a bridge can be made for people, that's great. A bridge can be made for vehicles, that's great. There are different types of vehicles. They're bigger vehicles, smaller vehicles. But if you build that bridge with the mass and the characteristics of those massive vehicles going across. I'm talking about like tanks and semis and whatnot. It will probably last longer than a footbridge. You see what I'm saying? Um, so that's a I mean a very watered down version of what I'm talking about. But when it comes to solutions, especially when it comes to the use of artificial intelligence, I feel like we have the opportunity and the duty to not only build but build responsibly, build in a way um, that reduces waste, right? So that is with incredible context and precision, uh, engineered in, and then you want it to be able to work today and work tomorrow under today's conditions, under tomorrow's conditions, because it is costly to have to reconstruct that bridge. It is costly to have to, well, maintain it, but to reconstruct that bridge whenever the next cohort goes across it, if that makes sense. We want the integrity, the relevance, and yeah, the integrity, the relevance, the performance, whatever. We want that for a long period of time because if I'm making the investment in building a bridge, if I'm making the investment and building a bridge today for a better tomorrow, then this the core, the fundamental component has to be capable of doing that, capable of longevity. You see what I'm saying? So it provides the foundation. Like we have a responsibility to, and last time I checked AI apps, I don't know what kind of foundations they have. A lot of times AI apps are built on top of platforms or tools are built with platforms, right? Some people are using, actually, I'm not even going to go into all that, but they're built on top of platforms. Like you can even go into some of your current CRMs out there right now, and you can even build apps within the CRM to help it work better to suit your use case. This is the sort of thing that I'm talking about. So, no, again, not building an application here. I didn't shut down. Well, not saying shut down, but neglect social media, trying to learn to swim and sing with my mouth open for an application. No, no, honey, I did not. Um, Also, what else does it does? It has features, intelligence, adaptability in the core design principle instead of an added feature. So again, this is why an AI native platform was what I had to have. What I had to have for you guys. So this is an example. This is not an example of trimesters. I put trimesters here just so you can see my logo. It's cute, right? But example is an AI platform could be a system that analyzes real-time data to optimize user experiences across multiple connected applications. See? Making proactive corrections and adjustments. Ooh, yes, 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 yes. Corrections and adjustments to what? Operations, the delivery of care, communication, things like that. All of these things are needed. And let me pause there really quick because I want you to understand that Trimesters AI is an AI native platform for maternal health specifically. So imagine all of this being built out for maternal health. I don't know. Actually, I do know, but I'm just being facetious. But think about this. Like maternal health in our country is, I mean, especially in America, which I mean, I have dreams, right? This isn't just for America, but we're going to start here in America. But um, imagine data-driven maternal care delivery, evidence-based architectures that continuously learn and adapt instead of having a system a stagnant system that cannot pivot, that cannot learn, that cannot leverage insights to do better. Come on. Like this right here is what I believe is needed in maternal health. Um, Foundation that can support various applications and services. So Trimesters already has a number of applications and services, or I call them modules, capabilities that are already out the gate there, ready to be used. Like one example would be, dare I say it, appointment scheduling, right? Another example would be waitlist automation. Um, like those. are capabilities that we already have. I mean, there are more, but capabilities that we already have that can be data driven so that those capabilities, like think about this, right? Think about appointment scheduling and waitlist management that is intelligent and data driven, and that data is hyper relevant. I'm not going to say hyper local, I just said it, but extremely relevant to the patients, to the community that that technology is being used by. Because last time I checked, communities are not a monolith. And especially when it comes to communities where folks might be marginalized, where traditionally folks might have experienced exploitation and hurt. Um, those communities are not a monolith in and of themselves. So you need to be able to have, well, we need to be able to have, and we do already have the capability of having data driven foundation for everything that is built on top of that instance or that use of the platform, if that makes sense. So, intelligence and adaptability in the core design, that is it. So, take all of these things here, core functionality, like the data driven, evidence based architectures, able to learn and adapt, take all of that and apply that to maternal health, noticing that you can build on top of it, build applications, build services, build offerings, build bodies of knowledge and research on top of this platform. Okay. Um, So yeah, so can you see the difference here? I hope you can see the difference between an AI native platform and an application because let me tell you, I did not. Full disclosure, this is a bootstrapped endeavor. Yes, friends and family, we are in the friends and family stage. If you would like to contribute, please, please, please reach out to me. Well, you already know. Feel free to reach out to me if you want to contribute. Friends and family only because that's where we're at right now. I'm not yoking myself to just anybody. All right. Now, let me go even deeper into this really quick. So, you guys have heard about there is a risk of mortality after pregnancy. There's a risk of mortality. We know that there is a gap in care. We know that there is a gap in support. There's a major opportunity there. And that is something that I understand deeply and intimately and still have my finger on that pulse. That is why you see me, y'all, in all of these meetings with y'all, right? That is why I'm continuously talking with moms in my DMs and I'm constantly engaging with folks in my community and other communities where we're hoping to share Esther is because yeah, identifying what the moms need and how we can deliver and how we can address those needs, meet those needs with technology. And the reason that I'm talking about technology and actually I'm going to talk about systems and the ability to do things is because of the definition of technology. What technology does, and you've heard me say this a million times, but what technology does is allows you to do more with less, allows you to move forward with less. I mean, the wheel is technology. A doorknob is technology, right? Your phone is technology as well. Um, but half of us don't use our phone to the fullest potential, blah, blah, blah. But I digress. But there's a reason why Esther has the capabilities that Esther has, why our roadmap with Esther is the way that the roadmap with Esther is, why we move forward in lockstep with validation for what Esther is now, and why we continue to seek input so that we can be informed and keep our finger on the pulse of what's going on and what folks need so that we can figure out together with moms, with the community, with the end user of Esther, because the end user of Esther are the moms, right? How to truly meet those needs with technology and ask ourselves, are we actually meeting those needs with technology? So, so yeah, there's a reason why the actually I digress. But yes, there is a course, and I'm going to share that with you guys soon. I'm building a course right now on how to, and it's obviously going to be free, right? But how to use Esther, the scope, the capabilities, all of that. So I did a little comparison here for you guys. Hopefully this is close enough for you to actually see it. But let's do the same thing. Remember, we went from application to platform. Now I'm going to talk quickly about the difference between a cute little application, which is what folks think that that I wanted to build, um, versus a multi-agent companion for moms, because that is what moms actually deserve and that is what moms need. And last time I checked, like, I hear you guys. I hear you guys. When you guys are talking about the system is broken, right? When you guys are talking about um, the fear of judgment, wanting to have a one-stop shop and things like that, like wanting the ease, a low lift solution that actually makes sense, and having something that fits your context. Um, like when I say context, fits your unique situation, fits you, fits your unique situation like a glove, right? Um, but yeah, so there you go. So I'm actually not going to go through all of these things here on this side about what an application or a single agent can do. I will share, I'll probably share some slides with you. But actually, I mean, you're going to see a lot of these concepts explained in the courses that I'll have out for you guys, so that when you're pregnant, and I mean, who knows? Who knows? But when you're pregnant, you can be going through this and learning these. And it's not like it's like some crazy geeked out, um, extremely strenuous course. What I want to do is make it to where you can go as deep as you want to in your understanding. And a lot of that information, or the videos that are going to be inside of that course about how to use Esther, those videos I will be posting on YouTube as well. It's just in the courses, I'll have exercises, and, I kind of hold your hand a little bit more to take you through these capabilities. But anyway, let's talk about multi-agent companion, because that is what Esther is, a multi-agent companion. So, mm, a multi-agent companion is a system composed of multiple autonomous AI agents, and they communicate with each other, they cooperate with each other within a shared environment. That shared environment is Esther. Okay. And there's typically an orchestrator agent that coordinates the team. That's Esther. But here it is, decentralized control. So intelligence decision making is distributed across multiple specialized agents. And I'll give you an example on the bottom of what that can look like. And it's designed for complex multi-step workflows that require specialized expertise and collaboration across different domains. That, in a nutshell, let me break that down. Imagine you have an agent, you have a head honcho. You have a head honcho. That's your orchestrator agent. That Oh, I'm gonna use a kitchen for an example. I'm gonna use a kitchen for an example because I love kitchens. Okay. Um, you have a head chef. You have a head chef or a restaurant owner or whatever. Head chef. That head chef might have might have different chefs under her or him, right? They might have a pastry chef that specializes in pastries. They might have a sous chef. They might have a chef that specializes in meat and protein or certain dishes, right? And so as the requests come out of the kitchen, that orchestrator is like conducting the team and is going like, okay, this is what you want. You want this is about to get lit. I hope I don't crash and burn with this metaphor, right? Um, but it gets lit. Like, so you have uh a chef that is over appetizers. You have a chef that is that is over certain dinners or certain entrees, and as I said, a pastry chef that's over certain desserts or whatever. I'm just being super simplified. Um, but anyway, so you you are in that dining room and you look at that menu, you know what you want, but I got something. I got something for you. You're in that kitchen or sorry, you're in that dining room and you're waiting for your food or you're getting ready to order your food. But you are unique. There's something different about you than a lot of the other people. Like there is you have allergies, for example. You might have allergies. So you're like, okay, I love this menu. Oh, this menu doesn't say that it has anything gluten free on it, but I really want to eat at this restaurant. So I'm going to inconvenience the staff. I'm joking. I'm speaking from a wound because I am gluten intolerant and lactose intolerant too. But anyway, um, so I want to order, and I'm not by myself either, right? So the situation is even more unique in that I am with my friend. I'm not by myself. I'm gluten intolerant. My friend isn't gluten intolerant. So that means that there is a level of specificity and a level of expertise that will be needed for me to enjoy my dinner and be safe and not get sick or have to go to the hospital after this. So I let the server know, or let's let's act like there's no server. I let the chef know, right? Which I've done this a few times where I'm like, can I speak with the chef, please? Because I really want to eat here, but and I talk with the chef quickly. I'm like, okay, yeah, I have these allergies. Can you make this dish, but make this dish to where it's safe for me to eat? And the chef is like, yeah, I think we can do that because the chef knows the ingredients, right? Not only that, but the chef knows, or not, I'm not even going to the ingredients. The chef knows who to ask to see if that's even possible. So the chef steps back into the kitchen, has a conversation with, let's say, with the appetizer, whoever's doing the appetizer. And they're also like, be ready on deck, other chef who does the entrees and other chef who does the desserts because she's probably going to want an entree, she's probably going to want a dessert, and she is gluten intolerant and lactose intolerant. Good luck. So they have their little huddle and they're just like, yes, this is possible. Uh-huh, 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 uh-huh. So that chef comes back to me and is like, okay, cool. Yeah, we got you. We can hook you up. We can hook you up. We got it. And not only that, but we can make sure that what we deliver to you is safe to you and that we don't mix up your food with somebody else's food, which, because you have two different orders. You want to eat two different entrees. Anyway, so that specialty chef for the entrees knows the ingredients. They are a chef. They're not just a robot where it's just like, I have to, no, they are able to reason, right? So they're not, in this scenario, the orchestrator agent is not just calling a static tool that just does this thing. That orchestrator agent is also calling, in this scenario, that appetizer chef that is also agentic, able to adapt and learn, and they're able to collaborate, right? So that not only do I get delivered to me for my appetizer something that is absolutely delicious and really exciting, nourishing, so it meets all my needs, but it's also safe. And that would not have been possible with just static, one size fit all, one size fit all cooking or kitchen, right? Because this chef, this sous chef, or this appetizer chef, the chef over appetizers, is like a freaking Gordon Ramsay of appetizers. And then you move on to entree, and then you have a Gordon Ramsay of your entrees, and then you have a Gordon Ramsay of your pastries, right? And this orchestrator is going between them. They're collaborating. They're collaborating. They're working together, right? So then I am able to be fed safely, and I am able, even with my unique situation and my unique needs and taste, I am able to have a appetizer, an entree, and a dessert. Whereas if I went anywhere else, I might not have the same outcome. Like if I went anywhere else, I might just get a sad salad with croutons or without croutons, because croutons have gluten in them. And that's actually a problem that I have in real life. I'm not trying to cap on anybody, but that's just what it is when you have allergies. When you have unique needs, um, those needs have to be met in a unique way or in a relevant way that is customized. You see what I'm saying? So it's the same thing like when it comes to it's the same thing when it comes to what we need as individuals in our situations after pregnancy. It's the same thing, right? Um, like how frustrating is it to um let me continue with the analogy. Let me continue with the analogy. So, and I already told you I would end up having to go somewhere, like if I went anywhere else, all I would get, and this is what I'm prepared for. When I go out with my friends or whatever, if I eat out, I typically cook my own food, right? But if I eat out at a restaurant and I go somewhere and they don't have a gluten-free menu, or I don't have time to figure out if they have a gluten-free menu, I am preparing myself to eat a sad salad with no croutons and no dressing because that is the only thing I know that is safe there. Even though the menu had all of these options on them, the options were not options for me. And a lot of times that is what moms are dealing with. Moms are dealing with, and I digress, moms are dealing with resourceless, like especially moms who are in tough situations, right? Resourceless, where half, if not the majority of the resources listed on that resource list they can't access, they can't use, they're not eligible for, or they're allergic to. You see what I'm saying? So things like that. That is that is why we knew, um, and that is why it was so clear with trimesters that in having a companion for moms, that companion, the technology had to be agentic, and it had to be it had to have multi-agent capabilities, because I don't know any other way of meeting those needs. And on top of that, the multi-agent team, I guess you would say, the group, is able to learn, so that if they have another gluten intolerant person come in, it's not going to be like their first rodeo. You know what I mean? Like, they learn. But that's what I love about, that's another thing that I love about Esther, is that the more context you share with Esther, the better the context. Or so like the more you communicate with Esther, the more Esther is exposed to your unique situation, the easier, no, I'm not going to even say the easier. It just gets better and better. It just gets better and better and better and better at addressing your context. And the complexity of your situation, the complexity of the task, complexity of your situation, right? And then of course scalable. So highly scalable. So new agents can be added to handle new tasks or increase workload without redesigning the entire system. Yes. So Esther is still in development. Esther will be in development hopefully forever, right? As we learn more needs, which actually I think, I mean, shoot, the fingers on the pulse, I'm not gonna lie. I mean, constantly learning, but I mean, you're limited to how quickly you can develop and whatnot, you know. But there will be other capabilities, and the capabilities of Esther will just continue to grow. So different types of chefs, different types of, yeah, let's just leave it at that. Different types of chef, whatever, to meet the needs of the mom, which is really really exciting. And then of course, let's talk about resilience, because again, I want this, moms need support today and tomorrow and at least a year. And of course, the let me tell you, the jury is still out. Like, folks are like, oh, the postpartum period, how long does it last? There's the fourth trimester, which we know when that ends. And then of course there's the whole year postpartum. But then we also know, like, in the brain and in the body, changes are happening 2 years out. So I'm not going to cut you off, but you see what I'm saying? Like, Esther still has to be able to deliver that support and deliver that value over time. And as complexity comes in, Esther needs to be able to adapt to that for you, so that you can safely receive, you see what I'm saying? Receive that support. And then of course, efficiency. Yeah, can achieve greater efficiency on complex tasks by distributing the workload and having agents work in parallel. And this gets really, really, really sick and awesome, because not only not only is Esther able to do these things and reason in this way and communicate with the team, but Esther's able to do this stuff fast, because last time I checked, we don't have time to waste, right? At 3 o'clock in the morning, 3 o'clock in the morning, when we need unique support, help, insight, whatever. Last thing you want is for that thing to be buffering and taking a million years to get back to you, to let you know to get back to you with your response. So there is that. I do have I have too many analogies. I'm going to skip this one. Um I already gave the analogy of the kitchen. And then, of course, the cat's out of the bag. I already told y'all about the upcoming course for moms. This is a quick sneak peek. I was going to show you the actual course that I'm building out, but I'm just like, ugh, I want to get my visuals together for y'all. But it's going to be lit. I'm excited. And I'm going to start releasing those videos as I work through this. I'm going to be releasing those videos on YouTube. But this is the type of education that you're gonna get. And again, as far, you can go as deep or as shallow as you want. You don't even have to touch the course if you're a mom, because last time I checked, you know, pregnancy brain is real, so whatever. But yeah, moms will learn about AI actually this says assistant, it needs to say companion, as a companion. And actually, I corrected that in my LMS system already. Folks will learn the limitations that Esther has currently. Those limitations will move and change and grow as we go. But current state, obviously, we know that Esther is not a doctor, and that is why that is why we want um there's a method to the madness. Like, we want providers in the trimesters ecosystem as well. I'm going to leave it at that. But some exciting stuff coming up there. Privacy and trust, about the chat interface, and about there's a setup quiz that I have because some people like to learn that way. Um, Folks will, and then these are the modules, mind you. The modules go into different lessons so that you'll be learning, like, under privacy and trust, like, you will be learning things like what to look for in privacy policies. And our privacy policy for Esther will be an example of that. And I will be, teaching from that privacy policy, things like that. Like, again, this course, yes, I do say it's for Esther, but a lot of the information that you get here will make you, excuse me, a lot of the information that you get here and the education that I'm going to share, and again, I'm going to have these videos on YouTube as well, um, will just help you navigate the digital space as well, because that's where we're going, and it makes sense to empower you with that without exploitation. So, and then last thing I wanted to share is, yes, in the works, I'm building out the one for moms first, but we're going to have courses for providers as well. And this is really, really exciting because providers, at least I'm talking about in the maternal health space. When I say providers, I'm talking about, you know, doctors and whatnot, but also I refuse to leave out our birth workers. You will have your own unique education where we go into, not only do we go into, again, teaching you about the trimesters platform, teaching you about Esther, just so you know about Esther, because I mean, chances are your patients will have Esther anyway. But also how to be a maternal health provider, a doula, a lactation consultant, a midwife, a CHW for for maternal health, but like how to navigate the new digital horizon, right? How to suss out bias, how to what to look for when it comes to governance, what to look for when it comes to HIPAA and HIPAA compliance, because a lot of folks out there will be like, "Oh yeah, we're HIPAA compliant." And it's like, "Is you? Are you really HIPAA compliant? Like, this is what it looks like, right?" And then, of course, we will also on the platform. So let me scroll back up. We're also, and this is what gets me really excited, on the platform. um, building out specific modules and tools for your unique use case and for your community, the community that you serve. Because too often we have technology that does not work for us or works for us in an afterthought. Like, I am a nurse, I get it. I know what it's like to fight with technology. I know what that's like. I've been in the clinical performance space for a while now. I'm not going to age myself, but I know what it's like to share or for I know what it's like to coach providers through technology adoption and see what it's like when that technology is not working for them, right? Um, no provider, I believe, goes to school saying, "Oh, I want to be chained to this computer," you know, or "Ooh, I want to chart forever," or "Ooh, I want to clean up after this technology all day long." When really, like, you want to serve your patients, right? So yeah, things like that. I digress. But anyway, I wanted to share that with you. And one more thing I wanted to share with you, if I can. One second. One more thing I wanted to share with you guys is this. Here we go. There we go. Here you go. So this is the website. So if you are this is not a sales pitch, right? This is just to let y'all know. Yeah, I'll put them in the bottom of the thing. But again, just so you understand, there's Trimesters AI, which is which is your AI native platform for maternal health. And then Trimesters AI brings you Ester. Okay. If you are interested in learning more, getting started, especially if you are a birth worker, uh, especially if you're a birth worker, just click get started. It will take you through a list of questions just so I get a better idea of what your practice is like and whatnot. And then you will end up on a call with me. You will be on a call with me, particularly to learn about or so I can see how we can support you or how this platform can meet your needs so that you can scale your care with your patients. And then I wanted to share this, and this is for other folks. So Esther is chat based. So and this is an actual conversation. So you can peep that at trimesters.ai. Real dialogue, contextual understanding, and Esther Core, which is the demo, is absolutely free. And then, actually, I should pull up. And then, if you go to moms, if you are interested in trying Esther, giving us your feedback, the demo version of Esther is available for you too. I'm trying to move this thing out of my browser, so hold on, let me 1 second. I'm gonna go to Esther. Ah, Esther chat. It would help if I had my contacts in.com. And then here, this is estherchat.com. So if you are a mom and you're just like, I want to check this out. The demo version is available to you for free. And actually, this, I would consider this early access because there are going to be some perks for you guys that try Ester out first. And also there will be, actually, let me just walk you through this, right? So tells you a little bit about Ester, mostly like the benefits, doesn't go into Ester being multi-agent or anything like that. Private, doesn't give medical advice, community access. So yes, there will be we are I'm working on finishing touches on the WhatsApp community for you and the social groups for you. And then also your feedback, which feedback will be external to Esther. Um, but this is just for you to help shape the future of Esther and what Esther does. Like I love to hear from you. So secure your demo and get exclusive community updates. What happens here, and I'm just going to be fully transparent with you, is when you hit the start my Esther demo now, what happens is I get the following information. The only information that I need to have is your email address. Do not feel like you have to put in your full name. I just put first name. You can put in, I don't, it doesn't matter. But your email address, and then of course where you are. And then once you fill that out, you're going to get an email from me with your link for Esther so you can interact with Esther and whatnot. But what giving me your email does, honestly, is it helps me stay in touch with you so that I can let you know when updates happen. Like I can let you know when the full version is available, or I can let you know when the WhatsApp community opens, or I can let you know whatever. It just helps me stay in touch with you, and kind of gives me a lifeline to connect with you. And then of course I will be sharing, I'll let you know like when certain workshops or events happen because I want to do that for you guys. Like how fun is it to be able to gather and talk about our experience with this technology, because I have a responsibility to make sure that it is actually providing value to you, because I want better outcomes for you. So there you go. So that was my long way of sharing with you all a little bit about what I've been up to and what has already been built. I understand that I'm meant to be building out loud, and I will hopefully, once I figure out this social media thing, be building louder than ever before. Um, but but yeah, I mean, this is just the beginning. This is just the tip of the iceberg, and it's really, really, really exciting. Again, friends and family, yes, yes, yes. Please hit me up because we are because development is not cheap, right? Um, so there's that. And then if you want more information, or if you're just like, whoa, what are the possibilities here? Feel free to subscribe to this channel, and then you'll continue to get updates on what's going on. And then of course you'll also get like little blurbs about my geeky musings and thoughts. Like I'm getting ready to drop another video on I'm actually, you'll see it. You'll see it. I'm getting ready to drop some very interesting videos on specifically about mental health and maternal care, and how actually, yeah, I digress. I'll let you know. I'll let you know. You'll see. But yeah, feel free to like, share, subscribe this, remix it, chop it up, get it out there. Uh, but yeah, that's my burning secret as to what I've been working on for the latest. Anyway, catch you on the other side. Thank you.
Look out for new updates.